That's right, Kelly. It is Stroke Awareness Month. We're here talking with Lisa Riley, Dr. Lisa Riley from Phoebe Putney from the ER over there. And of course, when we talk about stroke awareness, that's something lots of folks really need to be aware of. So tell us right off the bat, what is a stroke? Why is it important to be aware of strokes and maybe the symptoms that people could see?
Well, a stroke is when an area of the brain dies, the brain tissue dies because it loses its blood supply.
Right.
So that can happen, there's two main causes. Either a blood clot travels to one of the arteries in the brain and cuts off the blood supply, or one of the arteries in the brain starts bleeding and cuts off the blood supply to the area that it's supposed to supply. And it's important, very important, because it's the fourth leading cause of death in the United States.
Right.
And here in Georgia is the third leading cause of death.
Well, why do you think that is? Well, what do you think leads to that high propensity of stroke here in, let's say, Georgia?
We have a lot of the risk factors for stroke here in Georgia and southwest Georgia: high blood pressure, diabetes, high cholesterol, people overweight. And so all of those together, if you don't take your medicine properly and keep all of those risk factors down, leads to a lot of strokes.
And it all may start at the dinner table as well, taking better care of yourself, a little more exercise, maybe not smoking, things of that nature.
Smoking is one of the leading causes of stroke, and it's one of the most preventable causes. You can't not have diabetes, you can't not have high blood pressure, but you can definitely stop smoking today.
Yeah, and now you were saying that an area of the brain dies, so time is of the essence when you're talking having a stroke or the signs or symptoms that are happening. What should folks do, and how important is time? What would be the first thing someone should do?
Time is very important. So there is an easy way to remember the symptoms of stroke, which is FAST. So any problems with somebody's face or your face, if you notice there's any irregularity, any drooping to the face, any problems with your arms, your hands are clumsy, or your legs don't do what you want them to do, or your speech. So that's the F face, A arms, S speech, T is time. So time is very, very important. If you notice any of those signs, you have to immediately call 911. Either get to the hospital immediately or call 911. So the ambulances are equipped to recognize stroke and alert the hospital. We do have medications, if it is a blood clot, that can break up certain blood clots depending on the size and the location of them, but they can only be given within a certain 4.5 hours or so.
Wow. Okay, it's very important to stay aware of it. We're going to come back and talk more with you in just a little bit. Right now, we're going to head to a break. We've got more Good Day in Your Fourth Hour next.